important to put faces on this. You know, its numbers get so astronomical, people don't realize what's involved. So it makes a big difference. So we're waiting for Senator Casey and Senator Markey. So the fact that it's over here, they probably didn't give themselves. Well, this is, as we will point out, a pretty important day because the Republicans are announcing the bill. And they're probably doing it as we speak, 11:30. So it's close calls. We're not exactly sure what's in it, but it'll probably be pretty similar to what we had before. And a few little wrinkles. We do think that they will put a lot of money into control addiction, but it won't do it.
Rick used to work at HHS.
And also, you don't have to say it. You don't have to. Health centers don't have reimbursement. Programs don't operate in services, particularly for Medicaid. People can get, so it's not to be there. And so it's really a step backwards. So you looked at
HHS.
Yeah. And had a detailed finance committee for 20 years.
20 years ago, Matt Moynihan in Senate Finance Minority. It's probably the most fun I had in my whole career.
Yeah.
well, it's
Probably the hardest I've worked in my whole career, too.
we had one of our staff people, might have been
The name sounds familiar.
I don't know if he was with Moynihan or he might have been with Markey.
Okay.
On the budget.
Hey, Ben.
Hey, Bob. How are you?
Good to see you. So this is the order here, huh?
Yeah.
Yeah. Yep, this is great. Please go ahead.
This is Rick
Okay.
Warner. His son.
Oh, I didn't say hello, sorry.
Warner family.
Well, thanks everyone for being here. I'll start off today. I want to thank Senator Markey, Senator Cardin, the Warner family who are here. I know we'll be joined later by Senator Van Hollen, Don Flattery, Dr. Romanos. So we're grateful for your presence here. I want to start out by just a brief comment about some of the reporting just in the last hour about the next version of the Senate health care bill. Nothing I have heard changes my assessment of where this bill is. The bill that was introduced prior to this is a bad bill. It's a bill that sells out the middle class. It jacks up the cost of health care for too many Americans, and it decimates Medicaid. And when it comes to the issue of opioid addiction and the challenges that entails, the best thing we should do to combat that problem is to fund the kind of treatment programs at the local level that work when they have funding. We should make sure that Medicaid has the resources it needs to cover people and to give them both coverage and treatment for substance use disorder more broadly, and then in particular the opioid, those who need treatment for opioid abuse. That's what we should do. And by the way, we also passed legislation last year which was bipartisan, the so-called CARA bill, Comprehensive Addiction Recovery Act. We should fund that more substantially. If someone wants to do something about the opioid problem, fund CARA more robustly, make sure we have the dollars for Medicaid, and make sure treatment professionals at the local level have what they need in terms of beds and resources so they can provide the treatment that people should have a right to expect. We don't need a new fund in Washington, whether it's $2 billion or $45 billion or some other number. It doesn't really matter. We don't need a new program and a fund sitting there in Washington. I don't know how you even access it. What are you supposed to do? Get in your car when you have a an issue in your community on opioids and petition some fund. So that whole diversion is nothing but that, kind of an attempt to mislead deliberately that somehow you're working on the opioid problem because you've developed a new fund in Washington, D.C. Isn't that nice? But it's yet another bad idea in a series of bad ideas. So we have an obligation in the Senate, and the House does as well, to be serious about serious issues like health care more broadly, and in particular the scourge of this opioid epidemic. We don't have time for ideas that won't work. We don't have time for ideological extremism or pleasing one or two or three or four senators by these little tweaks and changes. We need serious policy because these problems are serious. These families demand and should have a right to expect that we're serious about this, not playing games with people's health care. So we still have a long way to go to solve some of the problems in our system. But the worst thing we could do is to pass legislation like the Senate Republicans have been proposing, which would take a wrecking ball to our health care system and badly damage any effort to provide quality, affordable health care for Americans, especially those who happen to be vulnerable and have a particular dependence upon something as critical as Medicaid. Senator Markey.
Thank you. Thank you, Senator Casey. And we thank everyone who has come here today, and my colleagues, Senator Casey, Senator Cardin, Senator Van Hollen. Many Senate Republicans clearly are in denial that we live in a country where 91 Americans die each day from an opioid overdose, where 500,000 Americans could die from opioids over the next 10 years, where 500,000 Americans could die from opioid overdoses in the next 10 years. 10 Vietnam Wars worth of deaths from one cause. 2,000 people from Massachusetts died from an opioid overdose last year. If people were dying at the same rate across the whole country as they were dying in Massachusetts last year, that would be 100,000 deaths every single year. That would be 1 million deaths over 10 years. If my Republican colleagues would focus on something other than giving billions in tax breaks to the wealthiest in our country, they would hear the near unanimous calls from the experts and the pleas from mothers and fathers to stop the machete that the Republicans are taking to Medicaid, which will hurt the prevention and treatment programs which these families so desperately need. They would hear the alarm bells Americans across the country are ringing against this cruel and inhumane and immoral legislation that they just introduced this morning. But instead of accepting the truth and listening to their constituents, they have decided to take a cynical path and replace life-saving services with for substance abuse, treatment, and recovery. As we speak, Leader McConnell is unveiling the newest version of the legislation to his caucus, which is rumored to include an opioid fund of $45 billion over the next 10 years. Now, that might sound like a lot, but the Center for American Progress estimated that the Affordable Care Act, if it stayed as the law, would spend over $91 billion for opioid coverage alone over the next 10 years. That's double what the Republicans are announcing today that they are willing to spend on opioid treatment for the families in our country. Why would we spend half as much on a massive public health crisis that is only getting worse. There has been a lot of talk from Republicans about so-called fixes to help make Trumpcare better for millions of Americans suffering from substance use disorders. But this opioid fund is not a fix. It is a falsehood. It is a lie. It is a false premise to the people suffering from opioid addiction. It is a false future that won't include critical Medicaid funding for treatment and recovery services. And it's a false bargain that Republicans will make at the expense of families desperate for opioid addiction treatment. But America will not be fooled. These families will not be fooled. This opioid funding is nothing but a politically craven effort to buy votes from Republicans whose states are being ravaged by the prescription drug, heroin, and fentanyl crisis. And this bill will be a death sentence for the 33,000 Americans who die every single year from opioid overdoses. So what is happening today is the Republicans are introducing legislation as a sop to an issue and a constituency which is desperate for more help. We need even more than $90 billion to deal with this. We have to give every family in America access to the health care which they need. This is a blistering, scalding indictment of the immoral and cruel heart of this Republican bill, which they're introducing today. And we are going to fight it every single day for those families across the country who are desperate for help. Senator Cardin.
Well, let me first thank Senator Casey and Senator Markey for their extraordinary leadership on this issue. On the issue of opioid abuse and drug addiction, my two colleagues have been leaders in the United States Senate on these issues, and I'm very proud to join them here today to underscore the importance of maintaining our commitment to deal with drug addiction in this country. I want to just share with you, over this past week, I visited two of our health centers in Baltimore. I went to Mosaic, which is a behavioral health center in Baltimore City. I went to Park West, where there was a group of community health centers that were represented there. And we talked about, quite frankly, the impact of the bill that passed the House of Representatives, and which the Republican leadership was promoting in the United States Senate, and what impact it would have on their ability to provide services. Now, let me first point out that the Affordable Care Act made giant leaps forward in dealing with this issue in two major respects. First, it expanded insurance coverage. In my own state of Maryland, 250,000 additional individuals were added to the Medicaid rolls. These are individuals who didn't have any coverage before. In addition, we had over 100,000 that got private insurance that didn't have private insurance before. We had close to over 400,000 altogether. In addition, because of the essential health benefits, Medicaid and the private insurance covered mental health and addiction. They didn't cover that before. So we now had more people covered and more reimbursement for behavioral health and drug addiction services. So when I asked Mosaic what would happen if the Republican bill would become law, they basically said they'll have to close their doors because they get a significant amount of their revenues from the Medicaid reimbursements. And if that dries up, they can't be there. So it's one thing to say, we're going to provide help. If you don't have these facilities to provide help, it's not going to be there. So Senator Markey and Senator Casey are absolutely right. This opioid fund is a dry hope for those that need the services because there won't be the services available because the community health centers will not be able to stay in existence. So it's critically important that we maintain the progress that we've made. And the Republican bill will deny those services. This is a growing problem. It's in every county in Maryland. We have opioid addiction problems, and we have overdose people dying every day. That's what's happening. And Senator Markey is right. He gives you these numbers. These numbers are on the increase. They're not on declining. We have to do a greater effort, not a lower effort. So it's important for us to stop this legislation from ever becoming law for many reasons. But to deal with the opioid crisis is one additional reason we need to deal with it. Now, I must tell you, hear the numbers. I'm going to introduce a father who has suffered the loss of his son. I want to thank the Werner family for being with us today. Senator Van Hollen, who had hoped to be here, is in a markup on the Appropriations Committee, protecting our funding for these types of programs. But we thank the Werner family for putting a face on the issue. Rick's going to talk about his son, Jamie. Debbie and Rick lost their son to the opioid crisis, and Jamie's brother, Stephen's, with us also today. Every one of these numbers that Senator Markey talked about is a family. It's been changed forever. A person who's been cut off from the opportunities of life. And that's what we're fighting for. We're fighting for life. Senator Markey's right. This is a life and death issue that we're fighting for. People's lives will be lost if we don't maintain our commitment to deal with this crisis. And I thank Rick Warner for being here to share with us his personal experience.
Thank you, Senator Cardin. As Senator Cardin said, we lost our older son, James. That's him in the picture right there behind Senator Markey with his dog, Jack, in a very happy time. We lost him to an overdose of fentanyl. He was 27. We called him Jamie. I'd like to tell you a little bit about him and also talk about addiction and opioids. He was a graduate of Walt Whitman High School in Bethesda, as well as the University of Maryland. I'm sure he is still rooting for the Terps. Most recently, he had been working as an educator in Rockville, working with kids who had special needs. He loved that work, and he was very good at it, developing bonds of trust with kids who can be very hesitant to trust adults. He was also a coach, having returned to Walt Whitman as an assistant football coach over the past 6 seasons. He enjoyed coaching his guys, the linemen, as he had been an all-county lineman himself in 2006. He also looked out for his guys, not just coaching them up, but helping them in the college process and even writing them recommendations. Whitman, in a very touching gesture, has decided to dedicate the upcoming football season to Coach Werner. Another of his passions was cooking, and he was quite the amateur chef. Nothing made him happier than shopping for food and then cooking up a storm for a house full of friends and family. His homemade macaroni and cheese is still legendary. We all greatly enjoyed those times until, of course, it was time to clean up. Over the past several years, Jamie started suffering from mental health issues. He thought he was schizophrenic, but was ultimately diagnosed with bipolar disorder. He had periods of highs and lows, which were very evident to those who loved him. He also started using drugs, including heroin. Substance abuse often goes hand in hand with mental health issues, as individuals are attempting to self-medicate. They're trying to quiet their mind and the pain related to its dysfunction. Similar to many of us who want to drink so we can stop obsessing about a particularly painful day. When we suspected that Jamie was using opioids, we tried to get him to seek treatment for his addiction. He would not and would never admit that he was using. He was 27, so that choice was up to him. Treatment for his addiction was our hope, but we lost him before he had that chance. Treatment is no panacea, as some addicts relapse, but we fervently wish that he had had that chance. So what have we learned from this? First of all, it's important to reach out and share your experiences. Talk to people. Don't feel judgment or ostracism. These issues can affect any family, regardless of income or status. You never know who you may help or who may help you. We need to shatter the taboo that sometimes seems to surround these issues and the hesitancy to discuss them. Finally, having health insurance is of vital importance, whether that is private insurance or a public program like Medicaid. Individuals suffering with addictions need diagnosis, counseling, and treatment. Without health insurance, these services are unobtainable for most. Any proposed legislation that takes health insurance away from large numbers of individuals will lead to serious health problems and death for some of those individuals. I urge the Congress, please do not let that happen. Thank you.
Don Flattery. Don, thank you for being here.
Sure. Thank you, Senator. Good morning. Thank you for having me here. You'll hear a number of echoes in some of my remarks. I'm not a Senate orator, so I'm going to rely very heavily on the written word. But my wife and I feel very strongly that it's critically important to personalize this issue because far too often discussions of this issue becomes obtuse and very clinical very quickly. And the people who have been lost to this are the faces and voices of this particular epidemic. So I'd like to introduce you to my son, Kevin. On, I don't have water with me. On Labor Day weekend, 2014, I lost my son, 26-year-old son, Kevin, and my only son, Kevin, to an opioid overdose. Like so many swallowed by this crisis, Kevin enjoyed the blessings of a typical suburban upbringing, attending private schools, participating in youth sports and high school athletics. He was an excellent student and was a graduate of the local all-male prep school, Gonzaga, right here in Washington, D.C., and later the University of Virginia, where he was actively participating in student and fraternity life. Kevin came to his addiction as a working adult while pursuing his talent and passion working in the film industry in Hollywood and New York City. He had been exposed to opioids as a teen after an injury and told me himself that he thought nothing of them. Like many, he underestimated the power of opioid drugs. While working, he began self-medicating issues with anxiety and depression with the widely available opioid prescription drug OxyContin, which is a common story as many struggling with mental health issues develop coincident addiction issues. He quickly became dependent and then addicted. He returned home to Northern Virginia in the fall of 2013 to his family, seeking treatment and our support. Like many struggling in search of treatment, he tried a variety of pathways, including inpatient detoxification, intensive outpatient, medication assistance with buprenorphine, STEP program support, and an outrageously expensive 28-day abstinence-only program. Some of these were covered by insurance, but others were covered out of pocket by our family. But, like others in pursuit of recovery, he experienced the painful and very common process of seeming progress and then relapse. Days before he was to start a program of the medically assisted treatment drug naltrexone, he used again and did not recover. In the nearly 3 years since losing my son, I've learned a great deal about the disease of addiction, the current epidemic, its underlying causes, and painfully evidence-based treatment opportunities that offer hope, but now only for others. I am a committed supporter of the use of medically assisted treatment for those afflicted by opioid addiction, born out of my son's experience. Even with a good family insurance plan and the benefit of continued young adult coverage provided by the Affordable Care Act, finding physicians with authorization to prescribe buprenorphine was difficult for my son. We must find ways to expand the number of physicians prescribing addiction-fighting medications, and we must remove and not increase coverage barriers to those potentially life-saving medications. Effective medication-assisted treatment already remains elusive for far too many patients. Changes to the nation's healthcare system that remove mental health and substance use disorder coverage as an essential benefit will be a disaster for those like my son seeking help. Slashing Medicaid coverage, which is now providing addiction treatment to vast numbers of people previously without any form of help, will be a death sentence for some. At a time when only 1 in 10 people suffering from substance use disorder receive any form of effective treatment, the need for reliable insurance coverage has never been so critical. 2016 overdose mortality statistics in this country will be at an all-time high. 2017 statistics are expected to be even more gruesome. My family struggled mightily to find treatment for my son within the current insurance marketplace. The thought of pursuing help for him under more expensive, skinny care coverage being proposed today is unimaginable. I implore members of Congress to not abandon the over 2 million people currently suffering from opioid addiction by undermining broad-based insurance coverage so essential to ending the epidemic before us. Americans suffering from substance use disorder deserve better from our elected officials. Thank you.
I'm Dr. Romanos. I'm a family physician from Columbus, Ohio. Thank you to Senators Casey and Cardin and Markey for calling attention to this crisis. And thank you to the brave fathers who shared their grief and the grief their families have gone through. As a doctor, I have seen firsthand the way opiates have devastated communities and families. Until 4 years ago, I was a primary care doctor in Lawrence, Massachusetts, where I treated patients experiencing opiate addiction. For many of my patients with addiction, having access to insurance through Medicaid was invaluable. It connected them to the treatment that they needed. One patient in particular comes to mind. When I first met Tracy, she was 25. She was struggling with severe depression and anxiety. And after trying to treat her own symptoms with pills that she bought from friends, she turned to heroin. She lost custody of her daughter, and when I met her, she was at a low point, desperate for help so that she could get her daughter back. It wasn't easy. She struggled for several years, and while she was in therapy, we worked to find the right medication for her. She even tried to take her own life. But over time, and thanks to her excellent insurance through Mass Health, the Massachusetts Medicaid program, she stabilized and she's been in recovery for 4 years now. Today, she's not just raising her teenage daughter, but also a toddler, which sounds really hard. Like every health crisis in this country, the most vulnerable populations are bearing the burden of the opioid crisis, including low-income people and pregnant women, the same people that rely on Medicaid for treatment and health care. In fact, the number of women hospitalized for opiate-related conditions and the number of women dying from overdose has risen at much higher rates than men. Pregnant women in rural areas are among the groups most likely to misuse prescription pain relievers, which puts them at risk for developing opiate use disorders that can be debilitating and deadly. Today, I'm proud to work for a trusted healthcare provider that serves these populations. Planned Parenthood provides sexual and reproductive health care, and in underserved communities, it's often women's only health care provider. In Ohio alone, more than 80,000 people go to Planned Parenthood for care. In order to address the opioid crisis, the Senate must protect Medicaid and its critical safety net providers. The Senate must not trade away people's affordable health care insurance for a measly opioid fund. A fund is not how we correct a health care crisis, and no amount of funding can replace the critical care that Medicaid provides. And yet, the Trumpcare Senate bill would not only take away Medicaid funds, it would cut maternity care and target those same populations of low-income patients by preventing them from being able to choose Planned Parenthood as their trusted provider. You cannot put a price tag on what this crisis has done to families and communities in this country. This is not about a dollar amount, it's about people. People who desperately need insurance to cover the care that they need. I am so proud to stand with the senators here today and other leaders in the Senate who understand that a fund for opiate coverage is not a substitute for the quality and affordable health care that patients in Ohio and around the country need. Thank you.
Thanks, Doctor. Appreciate it. Thank you. So we'll open it up for questions. I do want to first and foremost, though, thank not just my colleagues, but also Don and Rick for being here and for, as the doctor said, being brave witnesses, witnesses who will not only allow us to make arguments against why this bill is a bad idea, but also will give help and encouragement to other families that have suffered so terribly in this with regard to the opioid crisis, epidemic really. So we're grateful they're willing to come out here and tell their stories. It's not an easy thing to do, especially in the grievous circumstances they've had to face. So we're proud of their effort today. Just one fact that I should have mentioned earlier that Senator Markey, Senator Cardin referred to in their own states. Here's what Medicaid expansion in my home state means just on substance use disorder. Since Medicaid expansion went into effect in Pennsylvania, about 127,000 Pennsylvanians benefited from it who needed help because of a substance use disorder issue. Almost 68,000 of the 127,000 were in the opioid category. So tens and tens of thousands of people, and therefore tens and tens of thousands of families, have benefited directly from Medicaid expansion. So they're the numbers that matter. We should be figuring out ways to grow those numbers in terms of the number of people being treated instead of the proposal that's now before us or will be before us later today. So let's open it up if you had questions, or we can do them individually. Yes?
Senator Casey, I was wondering your thoughts on the cruise proposal that we're hearing may be included in the new Senate Republican healthcare bill. Your thoughts on that in general and how it might impact the substance abuse treatment?
Well, it's been described a lot of ways. One word which I think applies is junk. What we don't want is junk insurance. And look, every time they tell us that they're going to take this bill in a more moderate direction, it seems that there's a new element or several new elements that are even more extreme. And this is another example of that. So they're trying to I guess, make a pitch to an ideological point of view to pick up a vote or two or three. And it's not a serious effort, as I said before. This is serious business, trying to fix problems in our system, trying to give and expand coverage to people that need it. This shouldn't be an ideological exercise. So if anything, it makes a bad bill a lot worse, because ultimately you're going to be impacting issues like pre-existing conditions and what people should have a right to expect in their insurance policy and the coverage. Okay, well, we'll be around for a few minutes. Thanks, everyone, for being here. Thanks so much for your time and your help.